I am very pleased to introduce Undersecretary Kevin Concannon from USDA to give us a few welcoming remarks.
Happy to see you all. And my apologies, I'm not going to be able to spend as much time this morning as I wish. I'm headed off we're celebrating in a series of continuing celebrations the 40th anniversary of the WIC program, one of the most effective preventive health programs, in the whole panoply of federal and state programs. So I'm off to do that later, but thrilled to start today here with all of you. For those of you who have taken a look at the media this morning, print and otherwise, you see that healthy eating is very much in the news, starting right at the most important address in this town, the 1600 Pennsylvania Avenue. The First Lady yesterday hosted a meeting for people engaged in food and the efforts to really improve the diet of American children across the country. And we're very happy to be a major part of that and very optimistic about the impact on the lives of Americans, and know the theme and the work of NCCOR is one of the partnerships that we very much value on that front. Well, let me say right at the outset that the breadth and the reach of USDA programs has the potential on an ongoing basis for major impact in terms of healthy eating. The SNAP program serving more than 46 million Americans, nearly half of them children. The National School Lunch Program, 30 million children having lunch each day at school. 13.5 million kids, more or less, having breakfast at school. Both of those programs now subject to healthier eating requirements. The WIC program previously noted, even in spite of the lack of courage up at the end of the mall there in terms of white potatoes, the WIC program being a preventive health program and one that is science-based and happily, from our point of view, making a difference in the lives of millions of children, more than half of the infants born in the U.S. We're deeply committed to improving nutrition standards, have been making strides across our programs: National School Lunch, School Breakfast, the WIC food package, USDA foods. Each time I go out to a food bank, I look for the USDA foods. In part, I have a fetish about the labels. If they're colorful labels that mirror, let's say, Del Monte, I'm fine with them. But if they look white and not very thoughtful and possibly stigmatizing, then I communicate back with my partners at the Ag Marketing Service to say, get after those providers. But the good news is USDA foods, what used to be known as commodity foods, are healthier. They have less sodium than typically you're going to find in the supermarket shelf now. They have less, the fruits that are packed in syrup are always packed in light syrup. There's less sugar, less fat in the foods we're buying. So that goes somewhat under the radar, but it is a reflection, I think, of the authenticity of our commitment around healthier eating. We're revamping our resources, ensuring a strong evidence base, providing information that resonates with consumers, examining factors that influence our food and beverage decisions, our SNAP education, our SNAP Ed toolkit, an evidence-based approach to nutrition education across the country that, again, is in the middle of transformation. The 2015 dietary guidelines that our colleagues at the Center for Nutrition Policy and partners at HHS through CDC, NIH, HRSA are working on right now. The Super Tracker, available through the Center for Nutrition Policy and Promotion, derived from the facts and the dietary guidelines, and imprinting as much as we possibly can the brand of My Plate. Now the Super Tracker has nearly 4 million enrolled registered users, helping them individually across the world, really. And we continue to look for innovative ways to ensure that consumers have access to healthy choices, making those healthy choices more appealing. Farmers, we're helping farmers markets across the country. We're very focused on that this time of year in particular. And at last count, we're up to about 4,600 farmers markets and direct farm marketing that have both are authorized as SNAP dealers, SNAP providers, but have access to electronics so they can access SNAP benefits. Our healthy incentive pilot that went on for a year, ended a little over a year ago up in Western Massachusetts, demonstrated that you can incent people to eat healthier, more fruits and vegetables, the major gap most of us have in the American diet. And as I go out and visit schools, I was up in Massachusetts the week before last, on the North Shore of Massachusetts, visiting with a number of schools around farm to school, as well as sea to school. That was a new term for me. This was in Gloucester, Mass., a seaport that has a lot of fishing. And we had representatives from a number of school systems, again, reflecting the fact that kids are eating, contrary to what you see in some of the news items, kids are eating fruits and vegetables. And if you don't expose people to fruits and vegetables, you'll never get there. So we're staying the course in that regard. We're hoping that folks at the other end of the mall will have the courage to stand up for children and stay the course in terms of the nutrition requirements that we have in the school meals programs. The 2014 Farm Bill, the Agriculture Act of 2014, includes authority and funding to test innovative strategies to promote fruit and vegetable consumption among SNAP recipients through incentives at the point of sale. We're very excited about that. It's $100 million. And as I've traveled to states and meet with state folks, there's tremendous interest around the country in a variety of ways to say, would this be possible? Could this be possible? We're very open at this point. And since that is going to be a competitive grant, we are partnered up with NIFA at the USDA because they have more history with competitive grant making than we at the Food Nutrition Service. We're encouraging what we call the smarter lunchroom techniques. You know, we have a lot of fantastic dietitians, health policy folks who work in the food nutrition arena. We don't have anywhere near the number of behavioral experts that we really need these days. And so we're reliant upon friends in some of the major universities across the country that have specialized in this. We have a very strong relationship with folks up at Cornell University at the Benz Center. And they have put a package together that we promote. And I ask about when I visit schools, are you using smarter lunchroom techniques? It's a little inventory of a couple of hundred good ideas, low-cost ideas that lunchrooms can apply that result in kids eating healthier. The location of the salad bar, the fact you have a salad bar, the lighting in the room, the way you describe vegetables, the way you prepare vegetables, and the same with fruit. So we're also wanting to use some of that same behavioral health and behavioral economics applied to our SNAP program, because we do worry about, there are 46 million people that depend upon SNAP. And that number has come down by about 1 million people, reflecting some improvements in the economy, but it's still an essential lifeline and will remain so for the foreseeable future for tens of millions of Americans. And to the extent we can support them, help them, nudge them in the direction of healthier eating, that's what motivates our farmers market effort. Then we also want to see what else can we rely upon in the behavioral health, behavioral economics arena to incent people to use those SNAP benefits to eat healthier. We love what you're doing here. We rely upon that partnership with other federal agencies and organizations that are represented here in the room. We very much these days champion, rely upon, espouse a science-based and evidence-based approach to healthier eating. So what better company to be in? So thank you all.
All right, so it's time to get down to work. Thank you all. Okay, got a couple of slides here. First, I'm Diane Harris. I'm a health scientist at CDC, at Centers for Disease Control and Prevention, in the Division of Nutrition, Physical Activity, and Obesity. And I guess I'm the head of the planning committee here, although this was truly, truly a team effort between a lot of different folks to help us put this together. Actually, in your packet, you'll see that there's a list of the planning committee members. If you want to thank them all throughout the day for all the work that they've put into this, you can see that we had representation from a lot of different people, not only from CDC, but from some of your organizations out there and from some consultants, and really everybody stepped up and did a great job helping us pull together, identify who the right people are that need to be in this room, and pulling all of this together, including the work of FHI 360 in being our coordinating center and facilitator. So thanks to everybody that really put so much into this. The other thing I wanted to mention, Laura talked about the reading list in there. That was actually put together by an intern who was working with us for a few weeks earlier this spring. It's meant to be a starting point. If you have other references in your own evaluation reports, for example, that you would like us to include, we'd love to come up with a master list of reading materials that we can share amongst all of you, and going on into the future and these other convenings that we can share with each other. So please feel free to contact me or one of the other members of the planning committee to give us copies or to refer us to your own work documenting what's going on with your programs. And speaking of that, there is a table out there, and I see people have put out different reports and information, so thank you, and keep sharing. All right, so as we've mentioned many times, this is a jam-packed agenda today, and purposely so, because we've brought you all together. You are the experts, and we want to hear from you. So we've tried to get as many people in the room without it being too overwhelming in terms of actually having opportunities for robust discussion. So we'll try our best as facilitators to keep everybody on time with their comments and leave plenty of time for discussion. So the reason that we've decided to be a part of this and to help put this on, and from the CDC perspective, again, supporting USDA programs is a public health priority because so many of them are essential public health programs. And we have grantees ourselves who are working in this area, who are working on ways to support SNAP participants and to support farmers markets and all these different venues. So it's definitely a concern of our own grantees and the public health practitioners that we work with. So the time is now. We've been talking to people in the field. They tell us that the state of the art is developed so much, especially in farmers markets and as we move into grocery and other retail venues, that the time is ripe in order to understand where things stand and where the state of the practice is. So that's really our primary goal today, is to see where things are, what's working, what's not working. As far as the goals of healthy incentive programs, as from the CDC perspective and from my group, which is positioned to help people eat more fruits and vegetables in all different kinds of settings, that's an important public health priority. But we recognize as well is that general concerns around food access and the economic opportunities for farmers and for local agriculture is very important as well. And really the opportunities to support local and regional food systems and continue to develop those is an important goal I think that we can all share. So what we want to hear from you today as well is what are the things that are working, what are the things that aren't working, what are the barriers, and where are the opportunities for us to help each other from the government perspective and within your nonprofits and other agencies. How can you help support each other? And then as these programs are moving more into the grocery and the larger retail venues, what are the opportunities and what are the challenges as things get scaled up. And importantly, then we need to discuss what are the next steps and where do we go from here. I might mention that the Planning Committee is meeting tomorrow to debrief and to try and remember everything that was said today. We are live streaming this program, at least the presentations, so that there are a few people out there that are watching. We didn't spread that live stream link globally, but for those that wanted to be here but couldn't, we do have that opportunity, and this will be archived, so there will be ways to access the content later. Okay, so moving on to the agenda. I'm not going to take time to go through the entire thing, but want you to get a general sense for what we're after today. So the first couple of sessions are sort of the baseline. What's happening now? What are the nuts and bolts? How do different programs operate? What are their parameters? What's working, and what do we know about them? In the afternoon, we'll go to promising signs, what's making the difference, and again, looking at specific kinds of factors and how do different programs represent those factors in terms of things like partnerships. And we have an interesting opportunity to showcase a state program, which we hope will be rolling out relatively soon. And then we'll move more into the challenges. So later in the 115 section, that's more about the kinds of things that different programs have encountered, and then hopefully we'll get to some solutions later on. And then we have one session that's really the data. So for all the scientists out there, that's our session to really get into what are some of the data showing from the evaluation and other studies that have been conducted so far. And then later in the afternoon, so around 3:45 is when we're really going to have time to get into nitty-gritty kinds of discussions. So we'll have these breakout sessions, and we'll let you choose which breakout session you want to go to. We have one about farmers markets, one about grocery, and one about evaluation metrics. If you go to one of the different breakout areas, and do we have rooms assigned for each of these? We'll announce them later this afternoon, which rooms are for which breakout session. But if you go to one and it's really packed full, then maybe you'll think about moving to another. So we'll try and distribute yourselves among all of those three topic areas. And then us from the Planning Committee will be your note takers. And we have a facilitator from lots of different organizations that will help as well. And then we'll take a short time at the very end in order to share some of the key findings from our breakout sessions, and then wrap it up. So while we're getting the panel up here, why don't I answer any questions you might have? Could the first panel start coming up to the front, please? Are there any other questions we can answer? If not, we're going to jump right in.